EKG review. Function of heart: electricity and plumbing. With any functioning unit you need electricity and plumbing. Electricity, electrical current that stimulates the heart and tells it to beat or contract. Plumbing, when the heart contracts it provides blood and oxygenation to vessels, tissue and organs. Keep in mind how electricity and plumbing affect each other. Dead tissue will not allow signal to pass through. Electricity. Savenue bundle of his BBPF. SA, 6080 BPM. Avenue, 4060 BPM. BHBB, 2040 BPM. Accidents on a highway will be detoured around the blockage. Increased distance to travel equals increased time to get to location. Electrical current needs healthy tissue to conduct. Dead tissue will not allow signal to pass through. Plumbing beats equals contractions. Each beat requires atrial and ventricular contraction. Heart is like a sponge. It absorbs and squeezes out blood with each contraction. If it is not wrung out fully with each squeeze, it cannot absorb its full potential. Preload, afterload. Ventricular contraction pushes blood into arteries to be sent to body, tissues, organs and lungs. Tissue needs oxygen and blood to survive. Without this, it cannot function. Basic principles of EKG. Rate: fast, slow, normal. Complex: P in front of every QRS. P atrial contraction. QRS ventricular contraction. QRS. P. T. What is my rate? Each full complex is 1 beat. Most strips are 6 seconds long. 1, 2, 3, 4, 5. Hash of complexes in 6 seconds strip, x, 10, equals heart rate. 5 complexes, x, 10, equals 50 beats per minute. Cardia, heartbeat including contraction and relaxation. Arrhythmias. Normal, 60 to 100 BPM. Slow, less than 60 BPM. Sinus bradycardia, junctional. Fast, greater than 100 BPM. Sinus tachycardia, supraventricular tachycardia, VTAC. Cardia, heartbeat including contraction and relaxation. Sinus rhythm is normal electricity and normal plumbing. Electrical signal fires from sinus node. Rate is either slow, fast or normal. P wave is present in front of every QRS. Slow arrhythmias, sinus bradycardia, junctional rhythm, slow sinus rhythm. P wave is inverted or absent. Fast arrhythmias, sinus tachycardia, supraventricular tachycardia. Fast sinus rhythm. Supraventricular tachycardia. Supra-superior, above the ventricular. Rate is greater than 160 BPM, QRS is narrow. Ventricular rhythms, ventricular tachycardia, ventricular fibrillation. Tachycardia firing from the ventricle. Wide QRS, no P. Ventricular fibrillation. Fibrillation or quivering of the ventricles, no contraction/relaxation. No organized rhythm. Atrial arrhythmias, atrial fibrillation, atrial flutter. Underlying rhythm is sinus, with fibrillation between complexes/beats. Atrial flutter. Look at sawtooth pattern between waves. Just remember, dead meat don't beat. Asystole. No movement of heart muscle. Just remember, dead meat don't beat. EKG grid: small blocks, 0.4 seconds, large blocks, 20 seconds, time, seconds. V. O. L. T. A. G. E. 5 large blocks equals 1 second on strip. Small blocks, 0.4 seconds. Large blocks, 20 seconds. Block's underlying rhythm is sinus, must have PQRS. Normal PR interval is 0.12, 20 seconds, 1 big block. First degree, prolonged PR interval, greater than 20. Second degree IWB, PR gets longer, then drops beat. Second degree 2, more Ps than QRS, kids without parents. Third degree, total disassociation, no communication. Premature complex is PAC premature trial complex. P-wave upright in front of QRS. PJC premature junctional complex. P-wave is inverted or absent. PVC premature ventricular complex. Wide and bizarre, no P-wave. Other things to look at. ST segment. Depression, ischemia or injury. Elevation, infarct or death of tissue. Classified as significant if greater than 1 mm. STEMI is key point in ACS algorithm.